Question 1. A patient with asthma is admitted to the emergency department in acute distress. The nurse administers a short-acting beta agonist. After 15 minutes, the patient's peak expiratory flow rate, PFR, improves to 60% of baseline. What is the nurse's next action? A. Reassess the patient's respiratory status and provide further bronchodilators if necessary. B. Administer an intravenous corticosteroid for inflammation. C. Discharge the patient since the PFR has improved. D. Prepare the patient for endotracheal intubation. Answer. A. Reassess the patient's respiratory status and provide further bronchodilators if necessary. Rationale. After bronchodilator administration, the nurse should reassess the patient's respiratory status. If the PFR is still not at baseline, additional bronchodilator therapy or corticosteroids may be required. Question 2. A patient with chronic obstructive pulmonary disease, COPD, is being weaned off mechanical ventilation. The nurse notices that the patient becomes increasingly restless and their oxygen saturation drops to 88%. What is the first intervention? A. Increase the VO2 on the ventilator. B. Reassess the patient's airway and consider reintubation. C. Administer a sedative to decrease anxiety. D. Place the patient in a high Fowler's position to improve ventilation. Answer. A. Increase the VO2 on the ventilator. Rationale. The priority in this situation is to improve oxygenation by increasing VO2. Reassessing the airway and reintubation are secondary actions if oxygenation does not improve. Question 3. A nurse is caring for a patient with pneumonia who is receiving intravenous antibiotics. The nurse notes that the patient's temperature has not decreased after 48 hours. What should the nurse do next? A. Increase the dose of the antibiotic. B. Notify the healthcare provider about the lack of improvement. C. Administer an antipyretic to lower the fever. D. Increase the oxygen flow rate to improve oxygenation. Answer. B. Notify the healthcare provider about the lack of improvement. Rationale. The lack of improvement after 48 hours may indicate antibiotic resistance or a complication, so the healthcare provider should be notified to reassess the treatment plan. Question 4. A nurse is caring for a patient who is receiving a non-rebreather mask at 15 liters per minute for acute respiratory distress. The nurse notes that the reservoir bag is only partially inflated during inspiration. What should the nurse do? A. Increase the oxygen flow rate to 20 liters per minute to B. Replace the non-rebreather mask with a nasal cannula. C. Ensure that the mask is properly fitted and the valves are functioning. D. Switch the patient to a BiPAP machine. Answer. C. Ensure that the mask is properly fitted and the valves are functioning. Rationale. A non-rebreather mask must be tightly fitted to prevent air leaks and allow for proper inflation of the reservoir bag. Checking the fit and valve function is the first step. Question 5. A nurse is caring for a patient who has been intubated and is receiving mechanical ventilation. What is the nurse's priority intervention to prevent ventilator-associated pneumonia, VAP? A. Ensure that the head of the bed is elevated at least 30 degrees. B. Perform frequent suctioning of the endotracheal tube. C. Administer antibiotics prophylactically. D. Change the ventilator circuit every 48 hours. Answer. A. Ensure that the head of the bed is elevated at least 30 degrees. Rationale. Elevating the head of the bed reduces the risk of aspiration, which is the primary cause of VAP. Suctioning, antibiotics, and changing the circuit are supportive, but not as effective as proper positioning. Question 6. A nurse is caring for a patient with a tracheostomy tube. The nurse notes that the patient is producing thick, tenacious secretions. What is the nurse's first action? A. Increase the oxygen flow to loosen secretions. B. Perform tracheostomy suctioning using sterile technique. C. Increase the humidity of the air the patient is breathing. D. Administer a bronchodilator. Answer. C. Increase the humidity of the air the patient is breathing. Rationale. Increasing the humidity helps loosen thick secretions, making them easier to clear. Suctioning may be necessary afterward, but addressing the cause of thick secretions is the first step. Question 7. A patient with chronic bronchitis is receiving long-term oxygen therapy. What is the nurse's primary role in ensuring the patient's safety? A. Ensure that the oxygen flow rate does not exceed 2 liters per minute. B. Monitor the patient for signs of CO2 retention. C. Encourage the patient to use oxygen only during physical activity. D. Increase the oxygen flow during rest to maintain SpO2 above 90%. Answer. B. Monitor the patient for signs of CO2 retention. Rationale. In COPD, high oxygen flow rates can lead to CO2 retention, which is dangerous. Monitoring for signs of respiratory acidosis and CO2 retention is the priority. Question 8. A nurse is caring for a patient who has undergone a lung transplant. What is the most important action to prevent infection in this patient? A. Ensure the patient is on prophylactic antibiotics. B. Instruct the patient to use a mask when in public. C. Ensure proper hand hygiene by all healthcare workers. D. Keep the patient isolated from others for 3 months. Answer. C. Ensure proper hand hygiene by all healthcare workers. Rationale. Proper hand hygiene is the most important preventive measure against infection in immunocompromised patients, such as those who have had a lung transplant. Question 9. A nurse is caring for a patient on mechanical ventilation who is showing signs of agitation and restlessness. The nurse checks the ventilator settings and they are appropriate. What should the nurse do next? A. Administer a sedative to decrease anxiety. B. Assess the patient's pain level and administer analgesia if needed. C. Reassess the ventilator settings and adjust them. D. Suction the patient's airway to remove secretions. Answer. B. Assess the patient's pain level and administer analgesia if needed. Rationale. Pain is a common cause of agitation in ventilated patients. Assessing and treating pain should be the priority before sedatives are considered. Question 10. A patient with pneumonia is receiving antibiotics. The nurse notices that the patient's WBC count has decreased significantly. What should the nurse do next? A. Continue monitoring the patient and provide supportive care. B. Notify the healthcare provider about the possible infection suppression. C. Administer a second antibiotic. D. Reassess the need for oxygen therapy. Answer. B. Notify the healthcare provider about the possible infection suppression. Rationale. A significant drop in WBC count may indicate bone marrow suppression, a side effect of antibiotics. The healthcare provider should be notified to reassess the treatment plan. Question 11. A patient with ARDS is receiving mechanical ventilation. What is the primary goal of the ventilator settings for this patient? A. To increase tidal volume to improve oxygenation. B. To maintain a low plateau pressure to reduce lung injury. C. To decrease VO2 to minimize oxygen toxicity. D. To increase PEEP to improve oxygenation. Answer. B. To maintain a low plateau pressure to reduce lung injury. Rationale. The primary goal in ARDS is to reduce the risk of ventilator-associated lung injury by using low tidal volumes and maintaining a low plateau pressure. Question 12. A patient with suspected pulmonary embolism, PE, is being evaluated. What is the most critical diagnostic test to confirm the diagnosis? A. D-dimer test. B. Chest CT angiography. C. Arterial blood gas ABG analysis. D. Chest X-ray. Answer. B. Chest CT angiography. Rationale. Chest CT angiography is the gold standard for diagnosing pulmonary embolism, providing direct visualization of the embolism. D-dimer and ABGs are helpful, but not definitive for PE. Question 13. A patient with pneumonia is receiving IV antibiotics. After 48 hours, the patient is still febrile and showing signs of worsening infection. What is the nurse's next step? A. Administer antipyretics to lower the fever. B. Increase the IV antibiotics to higher doses. C. Notify the healthcare provider for reassessment of the treatment plan. D. Switch to oral antibiotics for easier administration. Answer. C. Notify the healthcare provider for reassessment of the treatment plan. Rationale. If the patient is not improving after 48 hours, the healthcare provider should be notified to reassess the diagnosis and consider adjusting the antibiotics or exploring other causes. Question 14. A nurse is caring for a patient who has been extubated after surgery. The nurse observes that the patient is showing signs of respiratory distress and hypoxemia. What is the most appropriate first intervention? A. Increase oxygen flow to the maximum level. B. Re-intubate the patient and secure the airway. C. Administer pain medication to reduce anxiety. D. Position the patient in a high Fowler's position. Answer. B. Re-intubate the patient and secure the airway. Rationale. The first priority in respiratory distress post-extubation is securing the airway by re-intubation if the patient cannot maintain oxygenation. Question 15. A patient with a tracheostomy tube is being suctioned. The nurse notes that the patient's oxygen saturation drops to 88% during suctioning. What should the nurse do next? A. Increase the oxygen flow before suctioning again. B. Continue suctioning to clear the airway. C. Administer a bronchodilator to open the airway. D. Reassess the tracheostomy tube for any blockages. Answer. A. Increase the oxygen flow before suctioning again. Rationale. The nurse should increase oxygen flow before reattempting suctioning to prevent hypoxemia. Suctioning should be performed carefully and with minimal duration. Question 16. A nurse is caring for a patient who has just undergone lung transplantation. What is the most important action to prevent infection in this immunocompromised patient? A. Ensure the patient receives prophylactic antibiotics. B. Instruct the patient to wear a mask when in public. C. Ensure strict hand hygiene among all healthcare workers. D. Isolate the patient in a private room for 3 months. Answer. C. Ensure strict hand hygiene among all healthcare workers. Rationale. Hand hygiene is the most important factor in preventing infection, especially in immunocompromised patients like those who have undergone lung transplantation. Question 17. A patient with COPD is receiving oxygen therapy. What is the most critical factor to monitor when providing oxygen therapy to this patient? A. Oxygen saturation levels and signs of CO2 retention. B. Respiratory rate and tidal volume. C. Heart rate and blood pressure. D. Body temperature and skin turgor. Answer. A. Oxygen saturation levels and signs of CO2 retention. Rationale. Patients with COPD are at risk for CO2 retention. Oxygen therapy should be carefully monitored to prevent hypoventilation and further respiratory acidosis. Question 18. A patient with a history of asthma presents to the emergency department with wheezing and shortness of breath. Which of the following is the nurse's first priority in managing this patient? A. Administer a short-acting beta agonist SABA. B. Administer a corticosteroid to reduce inflammation. C. Provide oxygen therapy to improve oxygen saturation. D. Order a chest X-ray to assess for any underlying pathology. Answer. A. Administer a short-acting beta agonist SABA. Rationale. A SABA is the first-line treatment for acute asthma exacerbation as it provides immediate bronchodilation and relief from wheezing and shortness of breath. Question 19. A patient on mechanical ventilation is becoming increasingly agitated. The nurse notes that the patient's sedation level is adequate. What should the nurse do next? A. Reassess the ventilator settings to ensure they are appropriate. B. Administer a sedative to calm the patient. C. Check the patient's pain level and administer analgesics. D. Increase the oxygen flow rate to reduce anxiety. Answer. C. Check the patient's pain level and administer analgesics. Rationale. Pain is a common cause of agitation, even when sedation levels appear adequate. Addressing pain should be the priority before considering other interventions. Question 20. A patient with suspected pneumothorax is receiving a chest tube insertion. The nurse notices that the chest tube is not functioning as expected. What should the nurse do first? A. Check for kinks or occlusions in the tubing. B. Notify the healthcare provider immediately. C. Increase the suction pressure on the chest tube. D. Assess the patient's respiratory status. Answer. A. Check for kinks or occlusions in the tubing. Rationale. Checking the tubing for kinks or occlusions is the first step in troubleshooting a malfunctioning chest tube. If no issues are found, further interventions may be required, such as notifying the healthcare provider. Question 21. A patient with acute exacerbation of asthma is receiving nebulized albuterol. The nurse notes that the patient's heart rate has increased to 120 beats per minute. What is the nurse's next action? A. Continue monitoring the patient and reassess. B. Notify the healthcare provider about the tachycardia. C. Administer a beta blocker to reduce heart rate. D. Reduce the albuterol dose. Answer. B. Notify the healthcare provider about the tachycardia. Rationale. Tachycardia is a common side effect of beta agonists like albuterol, but significant increases should be reported to the healthcare provider, as it could indicate a need for adjustment in therapy. Question 22. A patient with chronic bronchitis is using a metered dose inhaler MDI. The nurse notices that the patient's inhaler technique is incorrect. What should the nurse do next? A. Instruct the patient to inhale slowly and deeply while pressing the inhaler. B. Teach the patient to exhale forcefully before using the inhaler. C. Demonstrate the correct technique and have the patient try again. D. Administer the medication for the patient using the MDI. Answer. C. Demonstrate the correct technique and have the patient try again. Rationale. Correct inhaler technique is essential for medication efficacy. The nurse should demonstrate the correct technique and allow the patient to practice to ensure proper use. Question 23. A nurse is caring for a patient who has been extubated following surgery. The patient is now showing signs of respiratory distress. What should the nurse do first? A. Increase the oxygen flow to the maximum level. B. Reintubate the patient immediately. C. Assess the patient's airway and respiratory status. D. Administer sedatives to decrease anxiety. Answer. C. Assess the patient's airway and respiratory status. Rationale. The first action is to assess the airway and respiratory status to determine the cause of distress and guide the appropriate intervention, such as oxygen administration or reintubation if necessary. Question 24. A patient with a tracheostomy is being suctioned. The nurse notes that the patient's oxygen saturation drops to 85%. What is the nurse's first action? A. Increase the oxygen flow rate. B. Reassess the suctioning technique and oxygenate the patient. C. Suction the patient again to clear the airway. D. Notify the healthcare provider immediately. Answer. B. Reassess the suctioning technique and oxygenate the patient. Rationale. Oxygenation should be provided before and after suctioning to prevent hypoxia. The nurse should reassess the technique and avoid suctioning more than necessary, which can further decrease oxygen saturation. Question 25. A nurse is caring for a patient on a ventilator who is showing signs of ventilator-associated pneumonia, VAP. What is the nurse's priority intervention? A. Administer antibiotics as prescribed. B. Increase the ventilator settings to improve oxygenation. C. Perform oral care with chlorhexidine solution every 4 hours. D. Increase the patient's sedative dose to prevent agitation. Answer: C. Perform oral care with chlorhexidine solution every 4 hours. Rationale: oral care with chlorhexidine has been shown to reduce the incidence of VAP. While antibiotics are important, preventing VAP through proper oral hygiene is a priority. Question 26. A nurse is caring for a patient with COPD. The patient has been prescribed a bronchodilator. What is the most important teaching point for the nurse to include? A. You should use the bronchodilator only when you feel short of breath. B. You should rinse your mouth after using the bronchodilator to prevent dry mouth. C. You can stop using the bronchodilator once you feel better. D. You should use the bronchodilator regularly, even when you feel fine. Answer: D. You should use the bronchodilator regularly, even when you feel fine. Rationale: regular use of bronchodilators as prescribed helps to control symptoms and prevent exacerbations, even if the patient is not feeling acutely short of breath. Question 27. A patient with pneumonia is receiving IV antibiotics. The nurse notices that the patient's white blood cell WBC count has not decreased after 48 hours. What should the nurse do next? A. Continue the antibiotic regimen and monitor for further changes. B. Notify the healthcare provider about the possible antibiotic resistance. C. Administer an additional antibiotic to target other pathogens. D. Switch to oral antibiotics for easier administration. Answer: B. Notify the healthcare provider about the possible antibiotic resistance. Rationale: if the WBC count remains elevated, it may suggest that the infection is not responding to the prescribed antibiotics, requiring reassessment of the treatment plan. Question 28. A nurse is caring for a patient who is receiving oxygen via nasal cannula at 3 liters per minute. The nurse notes that the patient's oxygen saturation is 92%. What is the nurse's next action? A. Increase the oxygen flow to 5 liters per minute. B. Change the patient to a non-rebreather mask. C. Continue to monitor the patient's oxygen saturation. D. Encourage the patient to take deep breaths to increase oxygen saturation. Answer: C. Continue to monitor the patient's oxygen saturation. Rationale: an oxygen saturation of 92% is acceptable for many patients, including those with COPD. The nurse should continue to monitor the saturation and assess for any signs of hypoxia. Question 29. A nurse is caring for a patient on mechanical ventilation. The patient's peak inspiratory pressure, PIP, is increasing. What should the nurse assess first? A. Airway obstruction or secretions. B. Patient positioning and comfort. C. Ventilator settings and tidal volume. D. Oxygen saturation levels. Answer: A. Airway obstruction or secretions. Rationale: an increase in PIP is often caused by airway obstruction or secretions. The nurse should first check for these issues to prevent further complications. Question 30. A patient with ARDS is being mechanically ventilated with high positive end expiratory pressure, PEEP. The nurse notes a decrease in cardiac output and hypotension. What is the most likely cause of this condition? A. Decreased venous return due to increased intrathoracic pressure. B. Pulmonary edema due to fluid overload. C. Increased oxygen toxicity from high PEEP. D. Barotrauma causing lung injury. Answer: A. Decreased venous return due to increased intrathoracic pressure. Rationale: high PEEP increases intrathoracic pressure, which reduces venous return and cardiac output, leading to hypotension. Question 31. A patient with pneumonia is receiving oxygen therapy via a simple face mask at 6 liters per minute. The nurse notes that the patient is restless and confused. What is the first action the nurse should take? A. Increase the oxygen flow to 10 liters per minute. B. Switch the patient to a non-rebreather mask. C. Reassess the patient's oxygen saturation levels. D. Administer sedatives to calm the patient. Answer: C. Reassess the patient's oxygen saturation levels. Rationale: restlessness and confusion may indicate inadequate oxygenation. Reassessing oxygen saturation is the priority to determine if the current therapy is effective. Question 32. A nurse is caring for a patient with asthma who is using a peak flow meter. The patient's peak expiratory flow rate, PFR, is 50% of the personal best. What is the nurse's next action? A. Administer a short-acting beta agonist, SABA, and reassess. B. Recommend a trip to the emergency department. C. Increase the dose of the inhaled corticosteroid. D. Ask the patient to rest and take deep breaths. Answer: A. Administer a short-acting beta agonist, SABA, and reassess. Rationale: when PFR is 50% of the personal best, the patient is in the yellow zone, and the next step is to administer a SABA to relieve symptoms and reassess the response. Question 33. A nurse is caring for a patient on mechanical ventilation with a tidal volume of 8 milliliters per kg of ideal body weight. The nurse notes that the plateau pressure is above 30 centimeters H2O. What should the nurse do next? A. Increase the tidal volume to improve oxygenation. B. Decrease the tidal volume to 6 milliliters per kg. C. Increase the VO2 to improve oxygenation. D. Reduce the respiratory rate to decrease the plateau pressure. Answer: B. Decrease the tidal volume to 6 milliliters per kg. Rationale: a plateau pressure above 30 centimeters H2O indicates potential ventilator-associated lung injury. Decreasing the tidal volume to 6 milliliters per kg is the primary action to reduce the risk of lung injury. Question 34. A nurse is caring for a patient who has been extubated. The patient is experiencing respiratory distress and a low oxygen saturation level. What is the nurse's next action? A. Increase the oxygen flow rate. B. Reintubate the patient and secure the airway. C. Administer a sedative to calm the patient. D. Position the patient in a high Fowler's position. Answer: B. Reintubate the patient and secure the airway. Rationale: the priority action is to secure the airway if the patient cannot maintain adequate oxygenation after extubation. Question 35. A nurse is caring for a patient who has developed respiratory acidosis. What is the most likely cause of this condition? A. Hyperventilation. B. Pulmonary embolism. C. Asthma exacerbation. D. Hypoventilation. Answer: D. Hypoventilation. Rationale: respiratory acidosis occurs when CO2 is not adequately expelled from the body, often due to hypoventilation. Asthma exacerbations can lead to respiratory acidosis, but hypoventilation is a more direct cause. Question 36. A patient with tuberculosis is receiving airborne isolation. What is the most important intervention to prevent transmission to others? A. Instruct the patient to wear a mask when leaving the room. B. Ensure proper hand hygiene by all healthcare workers. C. Instruct the patient to remain in the isolation room at all times. D. Provide prophylactic antibiotics to visitors. Answer: B. Ensure proper hand hygiene by all healthcare workers. Rationale: hand hygiene is the most effective intervention to prevent the spread of TB. Other actions like mask use and isolation are also important, but secondary to hand hygiene. Question 37. A nurse is caring for a patient with a tracheostomy tube who is experiencing difficulty clearing secretions. What is the most appropriate intervention? A. Administer a bronchodilator to open the airways. B. Increase the oxygen flow to loosen the secretions. C. Perform tracheostomy suctioning using sterile technique. D. Administer antibiotics to treat potential infection. Answer: C. Perform tracheostomy suctioning using sterile technique. Rationale: suctioning is the most effective method to clear secretions in patients with tracheostomy tubes. Bronchodilators and antibiotics may be needed later, but are not immediate solutions. Question 38. A nurse is caring for a patient who has been intubated for acute respiratory failure. The nurse notes that the patient's peak inspiratory pressure is increasing. What should the nurse assess first? A. Respiratory rate and tidal volume. B. Oxygen saturation levels. C. Airway resistance or secretions. D. Arterial blood gases, ABGs. Answer: C. Airway resistance or secretions. Rationale: an increase in peak inspiratory pressure is often caused by airway resistance due to secretions or blockages. The nurse should assess for these issues first. Question 39. A nurse is caring for a patient who has been extubated after surgery. The patient is restless and anxious, with a respiratory rate of 30 breaths per minute. What is the most appropriate nursing action? A. Administer a sedative to decrease anxiety. B. Increase oxygen flow to maintain SpO2 above 90%. C. Assess the patient's pain level and administer analgesia if needed. D. Reintubate the patient immediately. Answer: C. Assess the patient's pain level and administer analgesia if needed. Rationale: pain is often a cause of restlessness and anxiety after extubation. The nurse should first assess and treat pain before considering other interventions. Question 40. A nurse is caring for a patient with COPD who is receiving oxygen therapy via a nasal cannula. The nurse notes that the patient's SpO2 is 92%. What is the nurse's next action? A. Increase the oxygen flow rate to 4 liters per minute. B. Continue monitoring the patient and reassess. C. Switch to a non-rebreather mask for higher oxygen delivery. D. Administer bronchodilators to improve oxygenation. Answer: B. Continue monitoring the patient and reassess. Rationale: an oxygen saturation of 92% is acceptable for many patients with COPD. Monitoring and reassessing is appropriate to ensure the patient remains stable. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.